All right. Any questions anyone had so far for chapter 23? No. All right. Then we will continue on. So the next thing that we're going to talk about is signs that would tell you someone is approaching death. One of those is a breathing pattern called Cheyne-Stokes. So Cheyne-Stokes, we'll listen to what you would actually hear here in a second, but it is very irregular breathing. So it's periods of slow, irregular breathing, followed by periods of rapid breathing, followed by no breathing at all, which we refer to as apnea. So let's listen to what that sounds like.
Every part of you is connected, so the way you care for your health should be too. Whether you need primary care, mental health support, or care for chronic conditions, Teladoc Health brings it all together to keep all of you healthy. Get started today.
Good morning, everyone, and welcome back.
All right, so just listen to this actual respiratory pattern. Make it bigger.
Today we'll be talking about Cheyne-Stokes breathing pattern. It can be caused by anything that causes cardiac damage, mainly endocarditis and rheumatic fever. When there is cardiac damage, the blood flow is disturbed. This causes irregularities in the carbon dioxide levels, which in turn affects the breathing center in the brain. We see it mainly in deep sleep or comatose patients. Cheyne-Stokes breathing pattern is described as a period of apnea, followed by gradual increase and decrease, and another episode of apnea. And here's how it sounds like. In most cases, treating the cardiac cause resolves the pathology. But if it persists, however, CPAP can be tried. Cheyne-Stokes breathing pattern is described as a period of apnea, followed by gradual increase and decrease, and another episode of apnea. And here's how it sounds like. In most cases, treating the cardiac cause resolves the pathology. But if it persists, however, CPAP can be tried.
Get rid of him. Go back to this. So very irregular breathing. A lot of times with Cheyne-Stokes respirations, it can be difficult to tell if someone's having a period of apnea or if they're just not breathing anymore. So you have to really listen in, watch their chest rise and fall. And again, good indication that someone is approaching death. Other indications, typically they start to internalize. So eyes become unfocused, vision becomes blurred, speech becomes impaired, sense of touch diminishes, they lose their ability to move, their muscle tone. Body temperature, in my experience, it typically rises. They're typically warm. Vital signs decrease. That includes blood pressure. Pulse becomes irregular. They have the Cheyne-Stokes respirations. They may have what's typically referred to as the death rattle. It's a gurgling sound while they're breathing. Skin becomes cold and pale, oftentimes becomes sweaty, especially if their temperature rises. They may become incontinent as well as disoriented or confused. And on their skin, as a result of a circulatory disturbance, you may see what is called mottling. Mottling usually starts in the distal extremities, so arms and legs, and then progresses to the trunk or the midline of the body. What mottling looks like is this. That doesn't want to get any bigger. Is this. So you can see the picture that's blown up there on the right. Normal legs on the right side, picture B, and then picture A on the left side. That is the start of what's called mottling. So again, it's a circulatory disturbance, usually starts in the distal extremities and then works its way towards the trunk. After someone has died, what sets in is called rigor mortis. So rigor mortis happens when after death, the muscles become really rigid and stiff, can make it difficult to move. Other things you'll notice, usually all of the muscles in the body release, so incontinence. The mouth, those muscles may release as well, so the jaw may remain open. Eyelids may remain partially open. There's usually a fixed stare. Also, there will be no vital signs, no heartbeats. So if you tried to check a pulse, you wouldn't find one. No respirations would be occurring, and there would be no blood pressure. Follow your facility's policy as far as what to do if you think that someone has died. Usually, facility policy is to call a nurse in. In order to call a death, meaning to determine that someone has died, it does usually require the nurse to make that call. Usually requires an RN. So like I said, follow facility policy for that. Whatever your facility's policy is, make sure that you notify the appropriate individual so that they can come and do a further assessment. Postmortem care is something that the nursing assistant is also responsible for. So that is caring for the body after death. Really important to know that if you need assistance, if that rigor mortis does set in, those muscles become stiff and rigid, that you get assistance. Ask your fellow nursing assistants or the nurse. Usually your facility will have a checklist for what to do for postmortem care. In general, we bathe the body, put drainage pads where they're needed, for example, under the peri area. We never remove any tubing or equipment. So if they have some sort of feeding tube, IV line, chest tube, we don't take any of that out. Follow the family's wishes and instructions as far as if they're going to be having their dentures in, if we are to remove any of their jewelry, what sort of clothing we are to put them in, if any. Depends on family preferences and facility policy for that. So just follow all of those instructions. We make sure to put the body in proper alignment, maybe putting a small pillow under the head, covering the body, continuing to provide that privacy. Usually in a facility, how it works is the postmortem care is provided, and then someone from the funeral home comes to pick up the body. So we can assist them with that procedure. Once the body is gone, we would want to strip the bed, clean the room, air it out, maybe open a window, and then do our documentation of that postmortem care. Always know your facility policy, know what you are supposed to do versus what needs to be done by the nurse. Again, if you ever have questions, just ask. If you're not sure exactly what to do with the residents' personal belongings or whether or not to put their dentures in or what clothing to dress them in, just ask. Important before you come into contact with this sort of situation that you think about how it would make you feel to be handling a dead body. Also, keep in mind, like I said at the beginning of this chapter, caring for someone who is dying is caring for that person, but also caring for their family. So keeping in mind that once death occurs, those family members may be pretty emotional. That may be a time where you're not only providing postmortem care, but also additional support for the family. So think about how you are going to be able to support the family while also providing postmortem care and potentially dealing with those feelings or those emotions that you are having as well. Also know that postmortem practices depend on background, experiences, religion, etc. So some people want to be buried in a casket. Some people want to be cremated and have their ashes spread around. It really depends on the preference of the resident and also the preference of their family. So remember, we're never judgmental of any of those practices. We remain professional in our job, and we allow the family or that resident's wishes to be followed. Know that, like I said, different family members will grieve differently. Not everyone is emotional. Some people don't even want to be present. Some people don't show any emotion and maybe feel a sense of relief. So it really depends on a lot of different factors for how that family member is going to respond. If you're ever invited to the resident's funeral or celebration of life, make sure that you follow facility policy on that. When I worked in the geri-psych facility, our policy for that was if we were invited to the service, our facility director of nursing would get that invitation. They would share it with everyone, anyone who was interested in going. We all went together and we all sat together and we represented our facility. If you didn't want to go, you didn't have to. If you didn't know the resident very well or you weren't interested, you didn't have to go. So it was up to you, but if you went, it was kind of a combined effort. Please note that different families are going to have different types of services for their loved one. Some of them are maybe an open casket ceremony where you can see the dead body. Some of them may be a burial ceremony where you go and they're actually putting the person in their casket into the ground. Some of them may be just like a celebration of life where the person is, the body is not actually there. You're just celebrating, remembering all of the good times. So be aware that there are different practices. If you're unsure of whether you'd be comfortable at those or not, just make that decision based on what you want to go to or what you don't. So think about if I said to you, you're someone that you knew before is going to die. What would you expect to see? And you're like, oh, a funeral. Maybe that's normal for you. Keep in mind, that's not normal for everyone. Think about what you've experienced before, what sorts of practices are familiar, maybe what sorts of practices you haven't experienced or that may bring up a little fear or anxiety. I remember when I was little, my uncle died, and they had a funeral for him. We went to the funeral, and at the funeral home, there was 2 different funerals that went on in separate rooms at the same time. And I remember I had to go to the bathroom during the funeral, and my dad was like, well, just go out the door and go left, and there's the bathroom. And I was like, okay. So I went out the door, and I went left. And the other funeral was going to be starting in the other room soon, and they were doing an open casket ceremony. So there was a dead body in a casket right outside the door. And I was like, what in the world is that? I was young. I had no idea that that was a thing. The ceremony that we were having was a closed casket, so I didn't see my uncle in there. And I was a little bit frightened. So being aware that that's something that can happen, knowing maybe your own feelings toward that before you actually get to one of those services and see that. A lot of times resident families will hold just like a celebration of life. So kind of like a gathering of family and friends, people who knew that resident, and they usually talk about like good memories. They show pictures. They have you write down maybe like a good time that you had with that person. So that's a nice way to celebrate someone's life without maybe having to go to something that makes you feel a little bit uncomfortable. So usually the invitation will say what it is. If it's a burial, if it's, a viewing, if it's a celebration of life. So be aware you're not required to attend. Don't have to. Can if you want. Any questions on death, dying, or hospice? No? All right. Then we will move into chapter 24. Chapter 24 is all about you and your career and caring for yourself as you enter into the healthcare workforce. So we won't touch on everything. Some of the things you'll just get to practice in your workbook, also in your modules, but we will go through some of it. All right. So careers in healthcare. There's a lot of them, to say the least. So if you are going into this career to be a nursing assistant and that's what you want to do, great. If you're going into becoming a nursing assistant so that you can progress on maybe to nursing or to become some sort of therapist or doctor, great. There are a lot of different avenues. Some people go in and kind of get some experience and then have a better idea of what they want to do. So if that's you, great, get some experience, try out different areas of care, different age groups, and figure out what you want to do. Keep in mind, healthcare is huge. There are a lot of different avenues. There are different settings you can work in, hospitals, long-term care, clinics, etc. There are different age groups, pediatrics, adults, geriatrics. There are different conditions, mental health conditions, physical health conditions. So if you get burnt out in something or you're tired of doing the same thing, you can always move to a different area and explore that as well. As far as employment goes, looking for a job in today's day and age is a little bit easier than it was when I first started in healthcare. Healthcare workers are in high demand right now, so a lot of different places are hiring. That's beneficial for you because there are a lot of different job opportunities. But also, you can really shop around for what's going to be right for you. You know, what works for your schedule, what pay works for you, what sorts of benefits are offered, also what type of care you're going to be providing. So, look on the internet. If you maybe have a facility in mind, maybe you know someone that works there, or there's a facility close by to where you live, go there. Ask them for an application or bring your resume and give that to them as well. When you're applying for a job, if you haven't done so before, you usually need a driver's license, proof of ability to legally work in the US. You will need your credentials. So if you're applying for jobs before you take your exam, you can let them know, you're pending your examination and this is the day it's scheduled. Or after you take your exam, if you're pending your certification, just let them know that. You also typically need references. Sometimes they request letters of reference, sometimes just reference emails or phone numbers so that they can reach out to them. I actually did one the other day for someone I used to work with. And the questions that they ask are typically like, what's this person's work ethic like? Are they reliable? Do they show up on time? If you were hiring them, would you? So make sure that you select references that know those things about you, people that you have worked with before, people preferably that you have a good relationship with. You don't want to put your worst enemy on there because if they say something bad about you, you're probably not going to get the job. So what's a resume? A resume is a picture painted for someone on a piece of paper that tells them everything about you. So basically your education, training, experience, all of that stuff laid out nicely on a piece of paper. Your resume is really your ticket into the facility. So your resume should represent you. It should look professional, should not have any spelling errors, grammatical errors. Make sure that if you are working through a resume that you have someone else double check it, whether it be a family member, friend, bring it into the school. We can look it over for you. Make sure that the resume that you are submitting is the best picture of yourself that you can put out on paper. So boast about your skills. Sometimes that's hard to do. I'm good at this. I'm reliable. I have dependable transportation. I'm organized. Boast about yourself. Tell about all of your great qualities. As far as other things that may be required when you're applying for a job, sometimes they request a cover letter. Ultimately, an introduction of yourself, telling them why you're applying for the job and also why you would be good for that job. A job application would be something that you would fill out either online or in person, usually answering questions for your qualifications, your education, your training for that job. So if you are filling out a job application, please make sure that you know all of that information or you have access to that information maybe on your resume. So like for me, I have a long history in healthcare. I can't remember the exact day that I started working at my first job or the day that I stopped working at that job. So have access to that info when you're filling those out. Here's an example of an employment application. Again, they'll vary, especially depending on if you're filling them out online or in person. So once you submit your resume, you fill out a job application, hopefully they like what you have to offer and they offer you a job interview. If you are offered a job interview, please show up early. Please don't show up late. That's a pretty good first impression, and that would tell me not to hire you if you showed up late. Please use common sense. Take a shower. Don't smell like body odor. Also, don't smell like you bathed in perfume. Brush your teeth. Make sure your hands are clean. Your hair is combed. You look presentable. Make sure your clothing is appropriate. So don't wear something that you would wear out on a night with friends. Wear something that would be appropriate either for your job duties, so scrubs, or some sort of professional wear, like a skirt and a nice shirt, or slacks and a nice jacket. So be aware of what you look like. Be presentable. Again, don't arrive late. Try to arrive early. Even if you get there 10 minutes early and you just sit in your car for 5 minutes before you go in, that's better than being rushed and being late. Never bring anyone but yourself to your job interview. And make sure that during the interview, you're professional, you answer questions, and if you have questions, make sure that you ask those as well. We are not going to go over job descriptions because you'll get a lot of practice on that in your workbook and we'll talk about it tomorrow. We will talk a little bit about, where did we go? Stress. So a little bit about stress, managing stress, and also conflict. Things I want you to keep in mind when you go into any industry, you are going to be working with people that may not be someone you would select as your best friend. That's okay. I want you to always keep in mind that the people that are working in the facility with you have the same interest as you, and that interest is to provide high quality care to residents. All of your other differences don't matter, right? We're all there to care for the residents. We need to work together to care for the residents, regardless of whether or not we have the same likes, dislikes, beliefs, etc. outside of work. Doesn't matter. We don't have to be friends. We don't have to be best friends. We don't have to talk after work. We just need to get along and care for the people in the facility for our shift. Very important. Also, knowing that if you notice someone is doing something incorrectly, or someone notices maybe that you're doing something incorrectly and they bring it to your attention, you need to be able to be receptive of constructive criticism and also be able to provide constructive criticism. So you would never go up to someone and say, "What do you think you're doing? You're doing that wrong." Instead, you would just say, "Hey, I noticed when you were doing this that you were doing it, this way, and I learned to do it like this, and so I just wanted to show you, how to do it correctly." Great. We should all be able to accept that sort of criticism as well as be able to provide it. Now, when things get stressful, maybe we're short-staffed, maybe we're working a double shift, Maybe we got a flat tire on the way to work, or we didn't get a good night's sleep, and we're experiencing a lot of stress. That criticism can become hostile. So be careful. If you're feeling that way, don't provide the criticism. Maybe bring it up to the nurse, let them know, hey, notice this person was doing this wrong. Didn't feel comfortable telling them. Maybe the nurse can follow up with that situation. So check yourself before you go to provide someone with that criticism. Also, like we've talked about many times, you need to be able to recognize that taking care of other people is stressful. You need to know how you as an individual manage stress. What sorts of things do you enjoy doing that help you to relax, help to distract you from the stress that is going on? My advice would be to take a sticky note, like so, write those things down on that sticky note, and stick them in a place where you will see them. So maybe your bathroom mirror, maybe your microwave in your kitchen, maybe the visor in your car. That way, when times get tough and you're stressed, you can look at that and you can say, oh, why don't I go do a craft? Or why don't I go for a walk? Why don't I bake some cookies? So you will know then that will kind of give you a reminder as to things that you can do to help with that stress. I personally would suggest the bathroom mirror, because typically that's where we go in the morning to brush our teeth and get ready, and where we go at night to brush our teeth and get ready for bed. So you'll see it twice a day. Also think about, and I'll ask you to share tomorrow, why you're choosing to become a nursing assistant, what sorts of things draw you to healthcare, what it means to you to be able to help other people. And in these stressful times, remember the value of the work that you have chosen. I can tell you that my most rewarding times working in healthcare were as a nursing assistant. Not only are you providing a lot of support and a lot of actual physical help too, but you're getting a lot of reward or benefit in return. I heard some of the coolest stories I have ever heard in my life, learned about some of the neatest things I have ever learned in my life from residents, just from being a CNA. So keep that in mind. Sometimes the days get rough. Sometimes you're taking care of people with dementia and they're asking you why? And it's like, whew, why? That's all I'm hearing all day. And you kind of have to remember, it's the disease, not the person, why you're in this career, the value of this work for you, and what you're giving to other people. Any questions on that? And there's some questions you'll answer the last pages of your workbook, and we'll go over those tomorrow. Kind of talking about maybe what you've learned or why you want to be a nursing assistant or where you think you want to work, that sort of thing. So be thinking about that. Any questions about any of today's content? No? All right. I want to show you a few things. So the videos that we watched, remember those are available for you as the skills videos here. So state exam skills videos, they're all posted. If you want to rewatch any of them, you'll be learning all of these skills in clinical. So if you want to reference back to these as you're learning the skills, each one that you click on will tell you where in your CNA skills handbook that skill can be found. Your CNA skills handbook is linked under the resources for you. So if you click CNA skills handbook, click on the link, it will bring you to this. This has your step-by-step skills in it. This also has a lot of information about your state exam. So if you are curious about your state exam, for example, here, like what to do on exam day, what to bring, all of that fun stuff is there. So I would start pulling this link up, looking through it. You don't need to know word for word what to do for each skill. Like I said, that's what you're learning in clinical, but just to get an idea of what that looks like, how to quickly find those skills so that you can review them and practice. Other than that, remember this announcement on the stream. Your badge photo, which is just a picture of you from the neck up with a light colored background, is due today. So you need to email in that badge photo. The email is there, as well as what to title your email. Tomorrow we will have our review day. So we will be doing a review session. We'll finish going through all the rest of the chapters in your workbook. Tomorrow is the last day for you to finalize a presentation topic. So make sure you have that selected. Remember that after tomorrow, you cannot change that topic. Also, next week, you will have Monday off. That is a holiday. On Tuesday, if you have missed any days of class, you will attend makeup day online. If you have not, you're off. So you have another free day. And then everyone will start clinical next Wednesday, the 31st at 7 o'clock in the morning. You need a reminder on what to wear, what to bring, reference your syllabus. Any questions about that before we talk about homework? All right. Homework, workbook chapters 21 through 24. We'll go over the answers to those tomorrow morning. Also, you have modules 5, 6, and 7 that will all be due tomorrow. So make sure that you get those done. The exams are all due at 11:59 p.m. Like I said, tomorrow we'll go over a workbook. We'll go through a review. If you have any questions from anything that we have covered, please bring them tomorrow, and I'm happy to answer them. We'll go through a breakdown of what to expect in the future. So we'll go over makeup day, clinical, and then your presentations. And then we will be on our way. Tomorrow usually goes pretty quickly, so probably be out early, probably a little earlier than today. Does anyone have any questions, comments, concerns, anything before I make sure you're all here and let you go? Nope. All right. Then if nobody has any hurt feelings about being let out early, I'll let you go and you can start working on your homework or go take a walk and then work on your homework or whatever you would like to do. Enjoy the rest of your day. I will see you all tomorrow, same time, same place. Yeah, Jessica?
So I know that you can't have like long acrylic nails, but can you have short ones or like none at all?
For nails?
Yeah, like the acrylic ones, the like fake ones.
So it's going to depend ultimately on the facility that you work in. For most facilities, the reason that they don't allow any nails, acrylic, gel, any of that stuff is because it harbors bacteria. So around underneath in the fine details, if you got like the little jewels on the nails or what have you, all of that stuff allows for bacteria to stack up, and that kind of defeats our purposes of infection prevention. So that's why nails typically aren't allowed in any length, fake nails, nail polish, gel polish, any of that stuff. As far as clinical goes, follow what it says in your syllabus. If you have additional questions or concerns, you can give the school a call or maybe send in a picture of nails if you have something specific. As far as your facility goes, facility policies are usually pretty strict.
Okay, thank you.
Yeah, the Jerry Psych facility I worked in, I was absolutely no nail polish, and your nails could not be any longer than your fingertips. So it's really strict. They also had very strict rules on tattoos and hair colors and styles and all sorts of things. So where you work, follow that policy as far as school goes. Just follow the policy in the syllabus. All right. Any other questions? No? All right. You're all free to go. Have a good evening. See you tomorrow.